Thank you, Mr. Speaker. Mr. Speaker, I rise today in support of S. 920, the National Clinical Care Commission Act, a bipartisan bill that has received unanimous support with both the House and the Senate chambers. S. 902 is a Senate companion to my bill, H.R. 309, which is co-sponsored by over half of my House colleagues. It has this level of support because our nation faces an epidemic. Diabetes or prediabetes affects over 100 million Americans. Nearly 1 in 3 of our neighbors is affected. This legislation will also help many others who are affected in fighting diseases like heart disease, obesity, and many others. When I first came to Congress in 2009, it was crystal clear that we had a big problem. The benefits of all the federal research dollars going into these diseases were simply not making their way to patients. Researchers at the NIH, the CDC, DOD, the VA, and the FDA weren't sharing diabetes research. Who knows? Sharing info may have put us on a path to cure diabetes. It was clear then, and it's still clear today. We need a laser-like approach to improve patient care by pursuing a strong federal focus on research. This bill accomplishes that goal by creating a National Clinical Care Commission comprised of doctors who specialize in diabetes care for patients. This commission will have 3 years to strengthen a partnership between federal stakeholders and health professionals who will bring a hands-on clinical experience to improve care. This is not a new, unending bureaucracy. After 3 years, this commission will sunset. In 3 years, it will be gone. We've already made such a huge investment of taxpayer dollars into research. It's time to leverage that investment into meaningful prevention and effective treatment options. President Reagan once said, quote, "There is no limit to the amount of good you can do if you don't care who gets the credit," end quote. And that's why I stand here today in support of my bill, which became Senator Shaheen's bill, because this bill will help so many Americans who are suffering from diabetes. So today, I ask my colleagues to get help all those who suffer from diabetes and their complex metabolic and autoimmune disorders by voting for S. 920. I reserve the balance of my time.